Okay, we are going to go ahead and start. So thank you all for joining us today on this 30-minute webinar regarding the new Comprehensive Community Plan. My name is Corey Smith. I am one of the program managers here at the Behavioral Health Division of the Indiana Criminal Justice Institute. Before we dive into the CCP, I would like to first discuss the reason why these changes have taken place. Now, upon joining ICJI a year ago, both myself and my director, Michael Ross, we took a deep look into the documentation and the processes that are required of local coordinating councils across the state. Through conversations with coordinators, our survey, listening feedback group, and internal team meetings, there was a common theme. The process and documentation was difficult to understand, it was redundant and onerous. Another observation was that each of the 92 different counties were on 92 different schedules. In other words, no county was on the same calendar. With having no common operating calendar, it makes it very difficult to anticipate when CCPs and quarterly reports were going to be submitted to us. With having no calendar, it proved difficult to track every LCC's activities and submissions. Our division received multiple emails from individual counties asking when their CCP was due, or asking for extensions, or if they were supposed to submit an update or a new plan for this year. Now, to us, it was obvious that this loosely based calendar was not conducive to enhancing the LCC's efforts to combat substance abuse. Therefore, the division is implementing a common submission calendar for all LCCs. And through the results of our survey we sent out last year, the calendar will begin starting on April 1st. That means that this particular format of the LCs or the CCP will be due on April 1st. Now, for more detailed list of submission dates, please reference the LCC's Policies and Procedures Manual that is posted on the ICGAI website. All right, let's see here, next. Okay, so for the CCP, we heard comments, concerns, and requests from all of you. Over the past 6 months, we have worked hard to develop new documentation that is easy to understand and less burdensome. So why did we change the CCP? For many years, the CCP was an open-ended document that was difficult to read, hard to analyze, and is difficult to complete. Within the first couple of months in the division, we noticed that there was no common structure or standard on how LCCs were completing the document. Some CCPs were over 50 pages, and some were no more than 10. Some listed specific actionable goals, and others listed very broad, unachievable goals. It was obvious that the purpose of the document was no longer effective. The CCP should be a document that gives the LCC life and purpose. Many coordinators voiced their concerns as to how time-consuming it was to complete the plan. Some stated that it took almost a couple of months to complete. Now, we had that in mind when we designed the new CCP. Our number one goal was to create a document that could be completed with ease and to put time back in your day. One of the responsibilities of our division is to report on the status of the LCCs to the Commission to Combat Drug Abuse. That responsibility includes telling your story in an impactful way. Having a document that is succinct, readable, and understandable will allow us to do so. We believe that the new CCP is a document that can be shared and easily understood by any reader within your community and anybody at the state level. By reading through the new plan, a reader should have an understanding of exactly what your LCC is doing to address substance use within your community. So, over the past year, the division has taken a strategic approach to overhaul our data collection, which has resulted in 4 quarters of unique data projects: the survey, the focus groups, site visits, and, you guessed it, the CCP. Because our research and planning division helped design the comprehensive community plan, they will be able to conduct a qualitative analysis of it. No longer will it feel like the CCP is just a document that is submitted, approved, and doesn't see the light of day again. Now, it has been said that change can be difficult. To mitigate difficulty and ensure a seamless transition to the new documentation and standardized calendar, one of our objectives is to provide a clear overview of the CCP through this webinar. Now, the Comprehensive Community Plan webinar is a two-part series that will provide a step-by-step overview, examples, and the importance of each section. Today is part 1 of the webinar, and part 2 will be 2 weeks from now, be at the same time. For more information on that, please reference the email that we sent out earlier. I think I sent it out last week. Or you can email me and I will send it back to you. So now before we begin part 1 of the Comprehensive Community Plan webinar, please note that you can locate the Policies and Procedures Manual and document templates on the Behavioral Health section of the ICJI website at www.in.gov/CJI. With that being said, let's begin the webinar. Okay, so this may seem trivial or already known, but the vision and mission statements plays such a vital role to an organization's existence. On the first page of the CCP, you will see the vision and mission statement page. Vision statements are future-based and meant to inspire and give direction. The vision is about the intended long-term impacts by your organization's work. It is a long-term goal that provides direction for the organization. It also communicates the purpose of the organization to the community with inspiration to achieve that purpose. But most importantly, the vision statement helps to attract and engage passionate, like-minded people within your community. For example, I believe this one came from Goodwill. Their vision statement says, every person has the opportunity to achieve his or her fullest potential and participate and contribute in all aspects of life. So moving on to the mission statement. The mission statement is the bedrock of any organization, whether it be a business or a coalition. A mission statement is a brief description of an organization's fundamental purpose. It answers the question, why does our LCC exist? By identifying the purpose of your work, an LCC can better understand the goals it should be committed to accomplishing. By having this strong foundation, you can build your organization from the ground up and ensure its stability through the challenges ahead. I understand that some of the LCCs, they may already have a mission statement, or some may be thinking about modifying their current one, or possibly creating a new one. Whichever you feel you want to do, just make sure that the mission statement expresses why your LCC exists. Now, as organizations evolve over time, it is not uncommon for them to lose focus of their purpose within the community. A strong mission statement can stop that in its tracks from happening, because every decision that is made by the LCC should flow through the mission statement. Mission statements aren't merely a form of important internal communication or process. They're one of the strongest messages that you can send to the public about the LCC's purpose. For example, I think this one's Goodwill as well, but we'll just say Goodwill works to enhance the dignity and quality of life of individuals and families by strengthening communities, eliminating barriers to opportunity, and helping people in need reach their fullest potential. So after the vision and mission statement comes the membership list. The membership list is a section of the CCP that is actually carried over from the old one or the previously used one. So the question is, what is a member? Well, there's no definitive answer to this question. It is really up to you to decide as to what your LCC considers someone, or as to how your LCC considers someone to be a member. Now, some LCCs have it addressed in their bylaws and others may not. That's okay. But things to think about when creating this list. Does this person show up to more than one meeting? Does this person participate in discussions during a meeting? Does this person participate in LCC events? Essentially, this should consist of members that are actively engaged with the LCC. Membership numbers vary across the state. For example, we have seen a county list over 100 members, and we've also seen a county only list 8. But what should be listed on the CCP is active members that are engaged in the LCC efforts. There is a saying that the more the merrier. Although having a high turnout of members is important, it is equally important to make sure you have members that provide representation from the areas of prevention education, treatment intervention, and justice services. Having 50 members only in prevention will actually do a disfavor to the LCC. There needs to be equal representation of sectors within the community to have an effective coalition. So why is the membership important to us? Well, LCCs, as I said, should have diverse coalition membership. The Behavioral Health Division encourages that each coalition contains members from the following sectors: youth, parents, business, media, schools, youth serving organizations, law enforcement, civic volunteer groups, healthcare professionals, state or local agencies with expertise in the field of substance use, and other organizations involved with reducing substance abuse. It is a recommendation that LCCs invite these key stakeholders to the meetings so the coalition can create an effective, comprehensive community plan. Addressing substance use is not a one-dimensional action plan. It is complex and needs key stakeholders from multiple sectors. Community coalitions are not prevention programs or traditional human service organizations that provide direct services. Rather, they are directed by local residents and sector representatives who have a genuine voice in determining the best strategies to address local problems. Now, to provide effective technical assistance and enhance an LCC's efforts, it's essential for us to know the composition of the coalition's membership. For example, a coalition is struggling to fund programs that fall under criminal justice services and activities. And they tell us that's because nobody's applying for the funds. As a division, the first thing we would do is to look at the membership list to see if they have members from law enforcement, court services, or probation services. If not, that would be a starting point for the LCC to engage with those sectors. Also, on this page of the CCP are the meeting dates. In this section, the LCC will list the dates in which they will be meeting for the year. This information is important to us so that we know how many times a year a coalition meets as a body. Also, this information will be used by the research team during their qualitative analysis. So following the vision, mission statements, the membership list, and the meeting dates, the CCP is broken down into 2 major sections: the community needs assessment and making a community action plan. When the division was developing the CCP, we set out to design a format that would empower LCCs to work together as a body to develop a plan that would be meaningful to their individual community. We have heard coordinators voice that they do all the work on the CCP and then present it to their governing body who approves of it. Now, although the coordinator is primarily the individual completing the document, the content of it should derive from the LCC body as a whole. Therefore, the community needs assessment is used to lay the foundation of the plan by the actual LCC and not just one individual. The first step in developing an effective substance use and misuse reduction plan is to assess your community. A community needs assessment tells your community's readiness to implement prevention, treatment, and justice-related programs to address substance use and misuse, and provides an overview of risk and protective factors. Not only does this section provide information that is relevant to creating a plan, but it also gives a non-member of the coalition an understanding of the makeup, composition, and presence or absence of resources within your community. So the first part of the community needs assessment is the community profile. This section should be actually pretty simple to complete as it asks for information relative to your community. Developing a community profile is another way to learn about the community in which you serve. It can help you understand the makeup of the community as well as the particular challenges people have when navigating substance use. The community profile consists of 1, the community name or the county name, 2, county population, 3, schools in the community, 4, medical care providers in the community to include hospitals, healthcare centers, and others of likeness, 5, mental health care providers in the community, 6, social service agencies that are relevant to mental health and substance use, 7, local media outlets, 8, substances that are most problematic in your community, 9, list all substance use, misuse services, activities, programs presently taking place in the community. Although the last one, number 9, seems very broad and may seem exhaustive, it actually does serve a particular purpose. For this box, to the best of your knowledge, you should list what is currently happening in your community. This has 2 purposes. 1, it establishes an understanding of your knowledge of the local ecosystem and where you may not be aware of efforts in your community. And 2, opportunities where efforts are lacking or missing within an ecosystem so that we at the state, we can facilitate connections with our state partners to help enhance your efforts at the local level. The second part of the community needs assessment is the community risk and protective factors section. So why a community risk and protective factors section? Well, there are many different and interrelated causes of problems and desired outcomes. If an LCC can understand these causes, it can focus its efforts to better contribute to community improvement. This allows your LCC to transform your community into the community that you envision, which can be found in your vision statement. See how this all connects? Now, there are basically the risk and protective factors. They are the aspects of the environment or personal experience that make it more likely or less likely that people will experience a given problem or achieve a desired outcome. Risk and protective factors are key to figuring out how to address community issues. It's a matter of taking a step back from the problem, looking at the behaviors and conditions that originally caused that problem, and then figuring out how to change those conditions. Risk and protective factors can affect children at different ages of their lives, or really affect people at different stages of their lives. At each stage, risks occur that can be changed through prevention intervention. Early childhood risks, such as aggressive behavior, can be changed or prevented with family, school, and community interventions that focus on helping children develop appropriate positive behaviors. If not addressed, negative behaviors can lead to more risks, such as academic failure, social difficulties, which put children at further risk for later substance use. Everything leads to something. So, what are risk and protective factors? Risk factors are characteristics at the biological, psychological, family, community, or cultural level that precede and are associated with a higher likelihood of negative outcomes. Protective factors are characteristics associated with the lower likelihood of negative outcomes, or that reduces a risk factor's impact. Protective factors may be seen as positive countering events. The more an LCC understands how risk and protective factors interact, the better prepared an LCC will be to develop appropriate interventions. So for the purpose of our CCP, we are not asking for a literature review or full-scale data review to develop these risk and protective factors. Because the LCC has community stakeholders, members should have some understanding of where their community exceeds or struggles when it comes to risk and protective factors. Although there should be some sort of information that leads to specific risk or protective factors, it is not necessary to list data sources of why the LCC has included a certain risk or protective factor. This is meant to be a starting point for the LCC to have a discussion. For example, what one law enforcement stakeholder may see as a risk factor, it may not be known or understood to be a risk factor by another stakeholder who is an educator. I had a phone call the other day where there was concern about all the information that needed to be listed for the risk factors and protective factors. Again, this is supposed to be more of a perception that has some sort of knowledge behind it. There's no need to include where your data source is, but this is designed to get communities to think about what are the risk and protective factors that are leading to the outcomes, so that they can develop problem statements further on in the CCP. Now, when I was a team leader in the 75th Ranger Regiment, there was a saying that a senior NCO continuously told me, that your team is only as strong as your weakest ranger. Now, this meant that our team effectiveness on the battlefield did not reflect our strengths, but rather was determined by our weakness. To improve our readiness and the ability to fight, we had to work together to improve our bottom line and actually be an effective team. So I know that the first part of our webinar, it just goes through some basics information, and we're really going to get into some substantive material in the next one. But this is just laying the foundation and provide you with some examples as well as some information of why these sections are important in telling your story and why we included them in the actual CCP. So I know there's going to be a lot of questions, and there's going to be questions about the CCP, questions about other information and things like that. So what we're asking to do, because we don't have enough time on this webinar to address the questions directly, please submit any questions that you may have so far to bh@cji.in.gov. And please title the subject as Webinar 1 question. If you do not title it as Webinar 1 question, it will possibly get lost. And we want to make sure we are addressing all the questions, because we are going to compile a frequently asked questions list and distribute this on our website. And a link of the webinar and the FAQ will be sent out after it is posted, so you all will know where to go. But also, if you want to find a copy of our policies and procedures manual and any other documentation that we may have uploaded, including the CCP template, quarterly report template, and things that are actually in the manual in the appendices section, you can see this link below, and that will take you directly to that part of the webpage. So I thank you all for joining us today. We'll move on to the second half of the CCP, which is actually creating the plan in our second part of the series, okay? So I hope that you all have a great day and that you enjoy the rest of your week. Thank you again.